Now, every part of medicine actually has a way, okay, a way they take history. Let me say you're taking history in cardiology. You focus on what? The heart. Is the patient breathing well? Is there optopnea, dyspnea, and all those beautiful stories? In orthopedics, you're actually dealing with bones, okay? So you are focusing on mobility, the range of movement, the stiffness, the pain, and all of that. Do you understand? So I just want to equip you guys on how they actually do history taking in orthopedics so that you can just be masters of that art in orthopedics here. All right. So history taking in orthopedics. So history taking is simply you are asking the patient about some things. So they are telling you very big stories. But you as an expert, you are sieving out what you need. Do you understand? So we said that history taking is a misnomer, all right? Because the patient actually tells a story. Now, it is we, the listeners, that actually what construct the history. Do you understand? The patient will just be telling you random things. They might even be telling you about what they ate before they now divert and tell you a little about what you even needed. But you are gathering all those what little informations and summing them up. Do you understand? So the story might may be maddeningly what disorganized, all right? But the history that you are arranging has to be systematic, all right? So carefully and patiently compile, right? It can be every bit as informative as what examination or laboratory tests. Of course, you can diagnose a patient from just the history taken, all right? So as we record it, certain keywords and phrases inevitably stand out because I told you guys in every department of medicine, there are some keywords that are looking out for. So in orthopedics, they are looking out for things like what injury. They are looking out for things like pain. So you clerk pain very well, looking the so using the Socrates, right? They are looking out for stiffness. They are looking out for swelling. They are looking out for deformity. They are looking out for instability. They are looking out for weakness. They are looking out for altered sensation. They are looking out for loss of function or inability to do some certain things, okay, that were easily accomplished before, right? So they are looking out to see that, okay, this injury, have it actually made the patient left walk? They are looking out to hear all those things, you understand? So each symptom is pursued for detail. So all these words we listed here, if they are found in the patient, then you have to detail them out. You understand? All right. So we need to know when it actually began, like when each of the symptoms began, and whether they began suddenly or gradually, whether they began spontaneously, that's just like that, or they began after some event. So is it that the patient fell from the tree? Is it that they had a road accident? Or were they just resting and the pain started? Or any other thing started? Do you understand? All right. Then you also what clock how the event or each of the symptoms have changed over time. Have it remained like that? Or have it been gradually changing? Or have it been what? Rapidly changing. Do you understand? Then you also have to list what makes it worse and what makes it better. Do you understand? If the patient has taken drugs before coming to your facility, you have to also what um, indicate it, right? Okay, it could be that they went to another facility, received care before being referred to your side, all of that, right? So while you are listening to the patient history, we consider whether the story actually fits some pattern that we organize for we are already thinking of a diagnosis already. Okay. So every piece of information should be thought of as part of a larger picture, which gradually unfolds our understanding. Okay. So the surgeon was philosopher, that's what we for trotter. Okay. Put it well as what disease actually what reveals itself in casual parenthesis. So the casual story that the patient is telling you is revealing the disease that they have in them. Do you understand? So history taking is very, very important. So in looking at the history taking in orthopedics, what are the symptoms you should look out for? they must be in your history. If the patient doesn't have, you say that they don't have. Do you understand? But they must actually be listed. All right. So you can actually even pause this video to develop a mnemonic for them. This one is just a picture. All right. This is one, two. These are the main things. So we have symptoms like what? Pain. Are they having stiffness in the joints? Are they having swelling in any parts of the body? Are they having deformities in any part of the body? Is there body weakness? To what extent? We have already told you guys everything to clack around every symptoms, right? Is there joint instability? Is there change in sensibility? Do they no longer feel like they used to feel? Or do they feel in a hyper way? All right. They look out for loss of function. That's function laser. All right. Then you look out for past medical history. Have they ever had such problems before? Or any other disease condition that they have had before? You look out for family history. Have this thing ever happened to any member of the family? They look out for what? Social background. Okay. So once you do all of this, I think you actually what? Be 100% in your orthopedics history. So that's it, guys.